Many men notice changes in their urination as they get older, but they often think it is just a normal part of aging. But if you are waking up several times every night to urinate, struggling to start urinating, or feeling that your bladder never empties completely, it could be due to an enlarged prostate, also called benign prostatic hyperplasia, or BPH. BPH is not prostate cancer, and it does not mean you will develop prostate cancer. It is a very common condition that affects millions of men around the world, especially after the age of 50. The prostate is a small gland located just below the bladder. The urethra, which carries urine out of the body, passes through the center of the prostate. As men get older, the prostate often becomes larger. But when the prostate enlarges, it can squeeze the urethra, making it difficult for urine to pass normally. This can lead to a weak urine stream, difficulty starting urination, stopping and starting while urinating, frequent trips to the bathroom, urgency, leaking urine, and waking up several times every night. Many men also notice that they still feel like their bladder is full, even after they have finished urinating. These symptoms may start slowly, but they often become worse over time. Some men ignore these symptoms for years because they feel embarrassed or think nothing can be done. But leaving severe BPH untreated can sometimes lead to bladder damage, bladder stones, repeated urinary tract infections, or even kidney problems in some people. The good news is that treatment has improved greatly over the past several years. Many men no longer need major surgery to get relief. Research has led to several minimally invasive treatments that can improve urinary symptoms with less pain, shorter recovery, and fewer side effects than traditional surgery. These treatments are not right for everyone, but they have become excellent options for many men. Before choosing any treatment, your doctor will usually perform several tests. These may include discussing your symptoms, examining the prostate, checking your urine, measuring how well your bladder empties, and sometimes performing an ultrasound or a cystoscopy to look inside the urinary passage. These tests help determine which treatment is most suitable. One of the best known minimally invasive treatments is the UroLift system. The UroLift procedure works by placing several tiny permanent implants inside the prostate. These implants gently pull the enlarged prostate tissue away from the urethra. Instead of removing prostate tissue, the implants simply hold it out of the way. This opens the urine passage and allows urine to flow more easily. But because no prostate tissue is cut or destroyed, many men recover much faster than after traditional prostate surgery. The procedure usually takes less than 1 hour. Many patients receive local anesthesia, light sedation, or general anesthesia depending on the hospital and the patient's health. Most men return home on the same day. Some men experience mild burning during urination, a small amount of blood in the urine, or mild pelvic discomfort for several days. These symptoms usually improve fairly quickly. One of the biggest reasons many men choose UroLift is because it has a very low risk of causing sexual side effects. Research shows that most men continue to have normal erections and normal ejaculation after the procedure. That is an important benefit because many traditional prostate surgeries can affect ejaculation. Imagine a 62-year-old man named David. David has been waking up 4 or 5 times every night to urinate. He avoids long car trips because he constantly needs to find a bathroom. After discussing his options with his urologist, he chooses the UroLift procedure. Within a few weeks, David notices a stronger urine stream, fewer nighttime bathroom visits, and much better sleep. But UroLift is not suitable for every patient. Men with very large prostates or certain prostate shapes may not receive the same benefits. That is why careful evaluation by a urologist is very important. Another excellent option is resin water vapor therapy. Resin uses the natural energy stored inside water vapor, also called steam. During the procedure, a small device passes through the urethra. Tiny amounts of steam are carefully delivered into the enlarged prostate tissue. The steam spreads through the targeted tissue. As the steam cools, it releases energy that destroys the extra prostate cells. Over the following weeks, the body's natural healing process removes this damaged tissue. As the extra tissue disappears, the prostate becomes smaller, the urethra becomes less compressed, making urination much easier. But, unlike Urolift, symptom improvement with Resum is usually gradual. Many men begin noticing improvement after several weeks. Maximum improvement often continues over 2 to 3 months. Some men temporarily need a urinary catheter for several days after the procedure while the prostate begins healing. Research has shown that Resum provides long-lasting symptom relief for many patients. Another important advantage is that sexual function is usually preserved. Imagine another patient named Michael. Michael is 68 years old and has moderate BPH symptoms. His doctor recommends Resum because his prostate size makes him a good candidate. For the first couple of weeks, Michael notices only small improvements. But by 3 months, he is sleeping through most nights without needing multiple bathroom trips. His urine stream becomes much stronger, and he feels much more comfortable leaving home. Like every medical procedure, Resum can have temporary side effects. Some men notice burning while urinating, frequent urination, mild bleeding, or discomfort during the healing period. These symptoms usually improve as the prostate recovers. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Another treatment receiving increasing attention is prostate artery embolization, also called PAE. This treatment is quite different from the others. Instead of working through the urethra, it works through the blood vessels that supply the prostate. PAE is usually performed by an interventional radiologist. The doctor inserts a very thin tube into an artery, usually through the wrist or the upper part of the leg. Using advanced imaging, the tube is carefully guided toward the arteries supplying blood to the prostate. Tiny particles are then injected into these arteries. These particles reduce blood flow to the enlarged prostate. Without its normal blood supply, the prostate gradually shrinks over several weeks and months. As the prostate becomes smaller, pressure on the urethra decreases. Urination becomes easier. Because no prostate tissue is removed through surgery, recovery is often quicker. Many patients return home on the same day. Research suggests that PAE works particularly well for some men with larger prostates. It can also be a useful option for men who may not be good candidates for traditional surgery because of other medical conditions. Imagine a patient named Robert. Robert is 75 years old and has heart disease. His doctors feel that traditional surgery may carry higher risks. After careful evaluation, Robert undergoes PAE. Over the following months, his urinary symptoms steadily improve, allowing him to sleep better and enjoy daily activities again. But PAE may not improve symptoms quite as quickly as some other treatments. It also requires a doctor with special training and experience. Like all procedures, it has possible side effects. Some men experience temporary pelvic discomfort, mild pain, frequent urination, or slight burning after treatment. These symptoms usually improve within a short period. Another newer treatment is called the iTind procedure. The iTind device is small, flexible, and temporary. The doctor places the device into the prostate through the urethra. No surgical cuts are needed. The device stays in place for about 5 to 7 days. During this time, it gently reshapes the prostate tissue. The pressure created by the device forms small channels that improve urine flow. After several days, the doctor removes the device during a short follow-up visit. Nothing permanent remains inside the body. Research shows that many men experience meaningful improvement in urinary symptoms after iTind. Sexual function is also usually preserved. Imagine a 60-year-old man named James. James wants symptom relief, but he's worried about permanent implants or major surgery. His urologist recommends the iTind procedure. After the temporary device is removed, James gradually notices stronger urine flow and fewer nighttime bathroom visits. Some men experience temporary discomfort while the device is in place. Others may notice mild bleeding, frequent urination, or a feeling of urgency. These symptoms usually improve after the device is removed. Many men ask which treatment is the best, but there is no single answer that fits everyone. The best treatment depends on several important factors. These include the size and shape of the prostate, the severity of symptoms, age, other medical conditions, current medications, and personal preferences. Some men place the highest priority on preserving ejaculation. Others want the fastest possible recovery. Some have prostates that are too large for certain procedures. Others may have medical conditions that make one treatment safer than another. This is why a detailed discussion with your urologist is so important. Research continues to compare these treatments over many years. Current evidence shows that all 4 procedures can improve quality of life for carefully selected patients. Every treatment has benefits and possible risks. No treatment is perfect. Your doctor will help balance symptom relief, recovery time, possible side effects, and long-term results. Lifestyle changes may also help reduce symptoms, especially during the early stages of BPH. Reducing fluids before bedtime can decrease nighttime urination. Limiting caffeine and alcohol may reduce bladder irritation. Maintaining a healthy weight and staying physically active may also improve urinary symptoms. Some medications for allergies or colds can make urination more difficult. But never stop any medication without speaking to your doctor first. It is also important to know when symptoms require urgent medical attention. If you suddenly cannot urinate at all, develop severe pain, notice large amounts of blood in the urine, or develop fever with urinary symptoms, seek medical care immediately. These situations require prompt evaluation. Research continues to improve BPH treatment every year. Doctors are developing newer procedures that provide better symptom relief with fewer side effects and shorter recovery times. This gives men more choices than ever before. If BPH is affecting your sleep, daily activities, travel, or quality of life, you do not have to simply live with it. Many effective treatments are now available. Talking openly with your doctor can help you find the option that best fits your health, your lifestyle, and your personal goals. The earlier you seek advice, the more options you may have, and the sooner you can get back to enjoying your daily life with greater comfort and confidence. See my other video on natural methods for prostate enlargement or BPH you can see above. Thanks.